good morning, good afternoon, or good evening, and thank you for joining us wherever in the world you are. My name is Ashley McKim, and I'm Editor-in-Chief of BMJ Innovations, and it's a real pleasure to welcome you to another virtual PMAC session. Today, we're discussing whether the health technologies from COVID-19 will lead to a permanent shift in how global healthcare is delivered. In this session, we'll take a high-level look at the technology trends which were delivered or matured during the pandemic and how they'll likely impact the future of global health over the next decade. The focus will be on 4 key technologies of vaccines, telemedicine, artificial intelligence, and health misinformation. Just a reminder that we want this session to be interactive, so please type your questions in the Q&A box and we'll take those at the end. You'll also be able to watch this session along with other PMAC sessions online at www.pmac2021.com. I'm going to shortly introduce our great speakers for today, but first we're going to try a quick introductory poll. You'll see a link to Slido poll in the chat box, so please go ahead and complete that. We're asking, what technology from COVID do you think will make the biggest impact over the next decade? That's what technology from COVID do you think will make the biggest impact over the next decade? So please take a moment and complete that. We'll share the answers shortly, but in the meantime, it gives me great pleasure to introduce our 4 experts for this session. I know each of you will be speaking very shortly, but for now, I could ask you to give a brief introduction, starting perhaps with William.
Thank you, Ashley, and I'm very excited to join you today. My name is William Moss. I'm a pediatrician and infectious disease specialist by training, a professor at the Johns Hopkins Bloomberg School of Public Health, and the executive director of the International Vaccine Access Center.
Wonderful. Great to have you with us, William. Kelvin.
Hello, I'm Kelvin Choi from the Chinese University of Hong Kong. I'm a digital epidemiologist. I'm working in the School of Public Health. And my focus is more on how we apply the digital technology to help for health monitoring or even for the telemedicines. I also organize the International Society for Digital Health. We are promoting the interdisciplinary research and collaborations between medicines and engineering. Thank you.
Wonderful. Thank you, Kelvin. Nikki.
Hello, greetings from snowy Geneva. I'm Nikki Shindo. I'm Senior Advisor for Global Infectious Hazard at WHO's Health Emergency Program. I also serve as WHO COVID-19 Publication Review Committee Chair and also serves as Head of Secretariat for the Strategic and Technical Advisory Group for Infectious Hazard. So I deal with lots of information. And here today, I would like to talk about infodemic and misinformation management from the Center of Global Response for COVID-19.
Wonderful. Great to have you with us, and we look forward to that conversation very, very shortly. Amandeep.
Thank you, Ashley. It's a pleasure to be back at PMAC and join the distinguished panelists today to talk about this very important subject. My name is Amandeep Gill. I lead the International Digital Health and AI Research Collaborative here in Geneva. Previously, I was Executive Director of the UNSG's High-Level Panel on Digital Cooperation, co-chaired by Jack Ma and Melinda Gates. I've been an ambassador for India prior to that, and currently I'm also associated with the Lancet FD Commission as a commissioner, and the commission is exploring growing up in a digital world, so digital health for the young people in particular from around the world. Delighted to be on this panel.
Wonderful. Well, it's great to have you all with us. So I think for all of us, 2020 was perhaps one of the most challenging years that many of us who work in healthcare will face in our lifetimes. And as we approach, I think, in the next month or so, that grim milestone of 2 million recorded deaths from COVID, I think with vaccines, we're starting to see the early progress towards a more normal 2021. But alongside all that human and economic devastation of the pandemic, we know that global disasters on the scale of COVID-19 also bring a huge imperative for innovation. Like past pandemics, we're likely to see some of these innovations continue to make a lasting impact in health long after we've brought this global health crisis under control. And this is not new. Ever since the first documented pandemics, they've always precipitated a stepwise jump in healthcare innovation. The third cholera pandemic of the mid-1800s was defined by the birth of modern epidemiology. Spanish flu of 1919 gave us our focus on public health, and also the International Bureau for Fighting Epidemics in Vienna, which was the precursor to WHO. I think looking back in COVID-19, it's likely that we'll see this as the digital health pandemic. COVID-19 was the first where the rapid deployment of technology, and specifically digital technology, became a core component of the race to understand, to contain, and deliver a potential solution. It was an AI algorithm that first alerted us to COVID back last year on the 31st of December 2019, and went on to successfully predict 10 of those first 12 cities to be impacted. It was also unthinkable at that point that we'd have one vaccine within a year, never mind a dozen viable vaccines from many different vectors. We saw many different digital health advances. We saw Bluetooth apps tracking and tracing millions of people in an attempt to control the spread. We saw AI algorithms working to analyze possible treatments and speed up clinical trials. And telemedicine, I think, became default in many countries as the first access to healthcare. Not all innovations were a success. Many failed dramatically. But like past global crises, some will evolve to play a permanent role in health beyond COVID-19. So with some caution, and I think not forgetting the horrific impact of COVID-19 on the lives it's affected, we're going to use some of this session to look at what's happened during COVID around technology, but also look to a more positive future where the health innovations from COVID will bring advances as we move forward. We're going to start with short introductions, remarks from our four experts. And I think one of the most dramatic and visible advances during the pandemic was in vaccine development. So I'm really pleased to first hand over to William Moss as our first speaker. William.
Great. Thank you, Ashley. I couldn't agree with you more that some of the greatest advances and really remarkable advances have been in the vaccine delivery platforms that we've seen over the past year. And it really is quite remarkable that just about a year into the pandemic, we have a number of highly effective and safe vaccines that we can begin deploying around the world. I do want to emphasize that the technologies that we're seeing in these new vaccine delivery platforms didn't just come out of the blue. They are the result of many years of research. But these technologies then were really poised to be deployed very quickly and developed very quickly for COVID-19 and against SARS coronavirus 2. I'll just start off by talking about some of these vaccine delivery platforms, and I have no doubt that these are really going to be transformative and have a permanent impact on the delivery of healthcare going forward. I'll first start with what I'll call very broadly genetic vaccines. And so traditional vaccines, let's say against a virus, what we use are either the whole virus, whether that's killed or attenuated, or a part of the virus, a particular protein or set of proteins from the virus. The genetic technologies are different than that. And basically what they do is they provide the genetic instructions for our own cells to make the proteins, the viral proteins in this case, and then our immune system recognizes and responds to those viral proteins. Now, one of the successful COVID-19 vaccines or set of vaccines are what we call adenovirus vectored vaccines. And so, for example, the audience is, I'm sure, familiar with the Oxford University AstraZeneca vaccine. There are other adenovirus vaccines that are being used, the Gamaleya vaccine in Russia. There's a Johnson & Johnson vaccine. These vaccines use a viral vector, adenovirus vector, to deliver the instructions to create, for our own cells, to create the spike protein, and then we develop the immune response. Now, this is a technology that's been around a long time. The first licensed adenovirus vaccine was in 2019 for Ebola virus, but we're seeing the increase in the use of this technology and the successful deployment of this technology for COVID-19. I think most striking have been the messenger RNA vaccines, and these the audience will be familiar with the BioNTech Pfizer vaccine and the NIH Moderna vaccines. And I think many people, including myself, have been really astounded by the protective efficacy of these messenger RNA vaccines. I don't think we expected to see 95% protective efficacy, and even in populations where we know the immune system can be weakened, or where we typically do not see as good vaccine responses, such as in older adults. So this has been a really remarkable achievement over the past year. But again, there was years and years of research underlying the development of this technology. The messenger RNA vaccines did not just come out of the blue, but they could be deployed very quickly. And one of the things about, one of the advantages of these genetic approaches, if you will, the viral vector vaccines, the messenger RNA vaccines, is that they're readily adaptable. One can kind of swap out, if you will, the genetic code, the instructions, the recipe, and adapt these for new pathogens, emerging pathogens, or old pathogens. And so I think we're going to see, particularly given the success of the messenger RNA vaccines, this platform being used more in the future. But I'll say it's not just in the genetic vaccines. There are, what's quite remarkable here is that there are 65 different COVID-19 vaccines in human trials. We have never seen that number of vaccines in development. And so we're going to see new, different technologies emerge from this. We're going to see new protein-based vaccines where we deliver part of the spike protein, the Novavax vaccine with delivering those proteins on nanoparticles. One of the technologies that, again, has been around for a long time, but could be accelerated with the COVID-19 pandemic, or the delivery of vaccines through what are called microarray patches. The University of Pittsburgh is working on such a vaccine. There are a number of advantages of that, but particularly it's just much easier to deliver. It's just a little patch that's put on the skin. The vaccine antigens are introduced into the top layer of the skin, and that can induce a strong immune response. So we don't need needles, syringes, medical waste. So a lot of advances, and I think that are going to be really have been and will continue to be accelerated through the pandemic. I just want to briefly mention other areas in the vaccine space where we may see technologies transform healthcare delivery, and other colleagues on this panel will probably address these. But one is in tracking who gets the vaccine, which vaccine, and at what time. There's been a lot of work on electronic immunization registries, but we could see this advanced through the pandemic, particularly in tracking vaccines in adults. And then the last area I just want to mention briefly is in vaccine safety and monitoring, what we call pharmacovigilance. This is critically important with these new COVID-19 vaccines, and I think electronic registries and apps for reporting adverse events will be another potentially transformative technology. Not that it's completely new, but that will really be advanced as a consequence of rolling out COVID-19 vaccines.
Wonderful, thank you, William. I'm really looking forward to discussing this later on. I think I was reflecting this morning that it was back last January that I remember reading the New York Times about the fact that we usually were looking at a 10-year span to develop vaccines. All the experts were hugely optimistic that we'd have the first vaccine in halfway through 2021, but we've achieved that in a much shorter time. So it's been hugely dramatic, that sort of shift in how we've done vaccine development. So look forward to talking about that more very shortly. Before we do, I'm going to hand over next to Kelvin, who's president of the International Society for Digital Health. We're going to talk a little bit more, both from Kelvin and Amandeep, around the digital health side. But Kelvin, do you want to give us your opening introduction?
Okay, thank you. Thanks, William, to visualize the future with vaccine. But in the past year, I think we all are in difficult positions. I try to put the countries of our speakers on the map, what happened in the past years. And it's very interesting because in each country, we have different population density. And at the same time, response to the COVID-19 are totally different. And you can see, unfortunately, the y-axis showing in a log scale, so that the number is increasing faster than it shows. We have different strategy, but without vaccines, today, we keep thinking about how to change our hygiene, our preparations, including wearing masks, or increase the social isolations. Then it comes up what is next, then we propose telemedicine. This is also in Hong Kong. Hong Kong is really a high density populated city. And we are not quite welcome telemedicine because we are quite easy to find doctors in the walking distance. But in COVID-19, it become another story. That's why we have telemedicine apps appear after the COVID-19. This is our local company to do a survey that we find that the teleconsultations with medical professionals become attractive, around half of the questionnaire replies. And the reason is we don't need to wait in the clinic. We can do any consultations when we feel good, and the consultation can do at home. This is all the features that we are avoid to get in touch with the COVID-19s or medical professionals. So this app is launched, but I don't know how good it is, but at least it changed our mind. We can book a consultation through an app, and then we report the symptoms, what we have, and then make a video consultations real time. This is a new trend, so-called technology, but sometimes this is very important that it connect to the clinical database. If we don't treat the patients without historical data, it is also difficult. So we think about how we can collect it to the healthcare system and some data beyond the system. This is why we come up with another idea of remote healthcare and support. This is an app that we can capture the blood pressure data easily and upload to the cloud. In the past, our population is quite good to do the blood pressure monitoring, but most of them using paper and pencil to write it down to see doctors. And after the consultation, throw it away. But it is unfortunate that chronic disease management become less important under COVID-19. I think it's quite common, but how we can deal with it? Sometimes the ecosystem change a bit. We get more community engaged health monitoring. What does that mean? For example, we include social workers to engage the elderly and engage them to do more home monitoring for their blood pressure. So we let this platform. And then we also apply this to the clinics and trying a model that whether the patients can keep track their blood pressure records, and they're really good and no urgency to see the doctors. So reduce the consultation frequency and also the time, it saves costs. But the last but not least, everyone will think about the data sharing, data security. Even we share the data to the professional, the technology, and sometimes we have some policy behind we need to discuss. This is very challenging. But what we carry out with the COVID-19, you may think about the test, the COVID-19 test. Many people willing to take the test because the test will tell whether you carry the virus, or after your vaccinations, you can have some control level that you can travel abroad. This is two way. The Common Pass is a Western country platform that similar to record whether you take the test, and then if it is negative, they will have a QR code to show you are healthy to travel abroad. But in Hong Kong, we also have similar concept. We connect this to the within China, different city. We have a lot of apps. We think about, we have platform, we have data, but the problem is the data sharing or the interface that we can communicate. Lots of technology that we need to think. The problem comes up. A lot of people worrying the privacy of the sharing data. It is challenging. And COVID-19 is quite different from the traditional health record, because in the past, when you have health problem, you don't mind to keep your record in the health system. And at the end, in the future, when you come up with another disease or similar disease, it will help you. But COVID-19 is quite tricky. Some people don't want to take the test. some people take a vaccine, but not sure the details of vaccine, or even we have different dose, no dose initial or just a full dose, we don't know. And even the patient themselves, they don't know how they take. So we did a platform, or even to avoid some misinformation that can communicate. And the right-hand side, lack of standardizations. As I mentioned, even the dose of vaccines can come from different drug company, and we still have a very limited data, including the side effect. So where we can share with them, and at the end, whether the form of data is standardized is quite challenging. So I find a company doing something like blockchain in healthcare, which is very important. First of all, we can start with a verifiable health passport. That means that everyone carry their data like a passport to travel. And blockchain is a kind of technique that it will keep the privacy by their own. That means that I just a secret of ID, but if you want to see it, you need to have another key to connect the platforms and see the details. And hope that this is a new types of concept that make the healthcare system data sharing more secure. And also, maybe very important, we decentralize the data. That means the data doesn't keep in one server, can keep by the patients, can be governments or other part of the world. And at the end, this data can contribute how we can do better to manage the disease. This is the new world. This is what will happening. Hope we in the common discussions we can discuss this direction more. Thank you very much.
Thank you, Kelvin, and that I think is a good setting for what comes next. I think we're going to talk from Nikki hear her introductory remarks around misinformation, which is a perfect follow-on from that. So Nikki, over to you for your brief introductory remarks.
Thank you very much. So we were given misinformation management, but this is all about information, how we deal with information. This is one of our Director General's press conferencing, and as you can see, that his quote on infodemic: "We're not just fighting an epidemic or pandemic, we're fighting an infodemic." You can't imagine how many media interviews and questions that we receive every day, and are also overwhelmed by social media on different misinformation and fake information. And people are worried about many things, and it's easy to reach us actually from anywhere in the world to directly question WHO about many things. So an infodemic is an overabundance of information, good or bad, that makes it difficult for people to make decisions for their health. And misinformation, disinformation, fake news can cause real harm to health, public trust, social cohesion, and emergency response. So these are some of the examples that I'm sure that you have seen them. And unfortunately, approximately 800 people have died and 5,876 have been hospitalized. 60 have developed complete blindness after drinking methanol as a cure of coronavirus. So this is a real problematic that people disseminate these kind of dangerous information. So I think if you can compare these pictures, it really illustrates how world has changed. People really relying on newspapers when we had this Spanish flu pandemic, but now people looking at mobile phone and tablets and computers to collect information. And the amount of information is incomparable to earlier in 20th century. So mostly publication, books, newspapers, but see this Wikipedia thing that has 6 million articles in English. And if you pile up all the printed out Wikipedia, you can see this little man standing. This is the height of the bookshelf. And you can see 13.5 bookshelf fully completed by printed material. So this is the amount of information we are talking about. The other thing is that everyone is an author, editor, and disseminator through all these major social media platforms and everything. So we have absolutely no control of emerging and mushrooming information, communication, rumors. So the infodemic during the COVID-19 pandemic, this is our business of every day. But this is the first pandemic in a highly digitalized society of 21st century. Managing the infodemic has become more challenging with spread of mis and disinformation through social media. In some countries, misinformation has generated mistrust in governments, public health authorities, and science. So this is really disturbing and problematic. Managing the infodemic management is critical to managing pandemic. So what is infodemic? Infodemic is a term coined by colleagues at WHO. It's really, I think, will capture and picturize the problem that we are facing. Infodemics thrive during times of uncertainty. People are uncertain and scared, and sometimes in a state of panic. And the falsehood really overwhelms the truth. 70% more likely to be shared than accurate news. People like sensationalism and rumors and some scary stories, but this will be more so during the emergencies and the time of uncertainties. So systematic use of evidence-based analysis and interventions to manage the infodemic during epidemic and pandemic is important. We have to analyze what people are thinking, talking, and behaving. So this is an example of how information flow can be managed. So somebody starts spreading out rumors, but there can be some just some incidental behavior can change the flow of information, but sometimes we can perhaps influence and educate individual how to deal or how to behave with rumors. That can perhaps change the flow of the information and the multiplication of information so that we can control the misinformation, disinformation. And also everything starts from listening and observing. So we have machinery, we developed the machinery to look at all these major social medias and analyze almost weekly to look at what people are speaking about, what people are worried about, and what the direction of people's consensus are moving. So these high hit topics, we concentrate on these issues on our pressers and the press conferencing to make sure these topics are covered with right information based on science. Well, so infodemic management is an evolving area of research and practice. This is part of science. WHO is technical agency of health of the United Nations. So what we based on is technically sound policies and guidance. And infodemic and epidemiology is also science. And it's a combination of social science and behavioral science and anthropology and many things. So this is an evolving area, and we do use heavily the artificial intelligence and automated analytics and data collection system that we work big data companies. And also we see a role of big tech and data companies in this. So Facebook, Twitters, and all these big social media companies are working with us. and help us by removing poor information, misinformation, remove content that is harmful, and implement policy. So this is really a critical area of work that we are gathering as infodemic. So I'll stop here. Thank you.
Thank you, Nikki. And it's a huge problem that I think we're going to address in our discussions later on this morning that crosses a lot of the other technologies as well. Just a reminder to everybody that, please, we've got the comment box where you can, the chat box where you can leave comments. So please do share any examples, tell us about your experience across these topics as well. And also we've got the Q&A box. So if you've got questions for our panelists, please post your questions in there as we go through, and we'll take those as we come into the panel discussion and the Q&A section as well. Before we do that, I'm going to hand over to Amandeep now for your introductory remarks.
Thank you very much, Ashley. Listening to you describe the world's previous experience with pandemics, I was reminded of another disaster, which is the sinking of the Titanic. Many lives could have been saved at that time if there had been interoperability and standardization of radio frequencies that could have allowed a better rescue effort to be mounted. There were many ships in the vicinity. And this disaster led then to discussions which culminated in the setting up of the International Telecommunications Union. So the question that you have asked us today, I think is very important. This pandemic is a turning point in many ways, how healthcare would be delivered through technology. Before I get to the area that you have asked me to focus on, which is data and AI, I just wanted to give a high-level perspective of where my thinking is coming from. So I mentioned the UNSG's panel. The key takeaways were that we needed new digital commons for development. We needed to work across the globe with data and artificial intelligence to make progress on the SDGs. And the best way of doing that was to create digital public goods, these common rails and these guardrails that allow innovation to scale in a responsible way and that lower the entry barriers to inventors, technologists, and cross-domain professionals. Now, in the health space, we know the nature of the opportunity to reinvent the health services, the power that the combination of AI data sets and computing capacity brings together for precision, preventive, and predictive health. But at the same time, there are these challenges. And the best way, according to me, to look at these challenges is through this 3Ms diagram. The missing data, for example, records of deaths and births, some things as simple as basic as that. Then poor quality, fragmentation of data sets, lack of interoperability. This is the problem of misuse of data. Data is there, but you're not using it well. And then there are obviously concerns on misuse of data, protection of privacy, and so on. So this is where our organization comes in, meeting an urgent need for digital cooperation for the principled and effective transformation of healthcare, as the DGWHO has put it. And one of the key aspects of our vision is to create a distributed CERN-like global problem-solving platform, which allows researchers, particularly younger researchers from LMICs, to come together and contribute to solving these global challenges. We, of course, realize that catalyzing human capacity, building relevant infrastructure and capacity requires investment. So making the investment case in cooperation with WHO and other actors is part of the vision. And these are some of the partners that we are working with. Now, what have we seen with the COVID-19 response? Kelvin, Nikki, and William have spoken to some aspects already on vaccines, for example. I don't think we would have been able to do 15% of Israel's population within 2 weeks if there had not been a strong bedrock of digitization, which Israeli HMOs such as Kalalit are already quite used to. There is the infodemic risk management aspect. There is the telemedicine aspect. There are other aspects of the digital enabling of the COVID-19 response. And I think we haven't explored enough the remote triage and testing aspects. But what I want to focus on is the AI-based database modeling issue, where yes, there have been models, and most models have been wrong in predictions or have not delivered the kind of policy impact that their makers would have hoped for. And one of the reasons could have been the lack of modeling and dashboarding diversity. So this is one of the challenges that we took up, and also the aspect of missing data. For real-time epidemiology to happen, you need to bring different kinds of data streams together, not just mobility data, but also molecular science data. We've seen with the phylogenetic maps of the new mutations of the virus, how that is so important in terms of managing the spread and the response. So one of the projects that we took up in India, this is a dashboard from the project in Pune, was to kind of deliver this kind of real-time capability to public health officials, but look for filling the missing data with proxy variables coming from qualitative data, from interviews and micro-narrative stories told by health professionals, health workers, and people on other people on the ground, and map that into a multidimensional risk dashboards that is more relevant to public health officials, rather than just telling them that these are the likely cases or number of deaths, etc., that are likely to take place. So I look forward to kind of in our ensuing discussion talking about what does this mean for the future. So real-time epidemiology and dashboards, but all the other areas where technologies are going to drive the transformation of health systems. How can they converge to deliver on the UHC challenge? And what does this mean in terms of going from solutions to enablers, broader horizontal enablers, such as the ones I've described, then to the normative aspect, which WHO and others are preoccupied with. I'll stop there and look forward to the discussion.
Wonderful. Thank you, Amandeep. I'm just going to pull up very quickly, if you can see it on my screen, we'll pull up just the results of our quick poll. So we asked people at the very beginning their views on the technologies that from COVID they thought would make the biggest impact over the next decade. And unsurprisingly, a lot of the topics that we're covering today, I think vaccines was a big part of that, as you can see, telehealth and AI technologies, but lots of other ones in there as well. I think, education, we made huge steps forward in how we did virtual education and distance learning as well. And the track and trace apps were in some cases successful, in other cases not what we hoped as far as helping with COVID as well. So thank you for completing this. We're going to cover some of these key topics, and also I hope you'll learn some other technologies from COVID as well that will make an impact going forward. So thank you for completing that poll. What I'd like to do now is bring all our panelists back onto the screen, and I want to start that discussion as a group. So we've heard a little bit today from our experts on what happened in their fields, in their technology fields during COVID. But I want to start by perhaps being a bit more optimistic and looking, forward to the future. So if we look forward, 5 or 10 years, I'd love to hear your thoughts on what you hope that we can look forward to. And maybe starting with William as well. You already touched on, the huge advances that we've had in vaccines. But how do you think this technology will help us going forward, addressing some of the other infectious diseases that we're looking for, vaccines for? And what would you hope that we might be able to achieve over the next sort of 5 to 10 years?
Yes, thanks, Ashley. I think there are a couple of things in the vaccine space that could really be visions or ambitions going forward over the next 5 to 10 years. One is, leveraging the work. And again, I want to emphasize again that these vaccines are based on, really decades of research, but really advancing our ability to combine vaccines and simplify the delivery process. So, for example, if we had a microarray patch that didn't require needles and syringes, no medical waste, could be delivered by less trained healthcare workers or even the lay public against multiple pathogens. I mean, and that was heat stable, so we didn't require a cold chain. Those types of technological advances could really, I think, have a major impact on our ability to achieve high levels of vaccine coverage. So I think we're in some ways kind of on the cusp of a really transformative revolution in how we deliver vaccines. That there's still going to be the demand side, and we'll talk more about misinformation and dealing with that. And so we need efforts to build the trust in vaccines, but I think we can see transformative technologies in how we deliver vaccines so that we're covering multiple antigens with a single vaccine, so fewer shots, if you will, and technologies where we can get away from needles and syringes and have easier delivery. So I think that's one big area. To pick on some of the up on some of the things that some of my colleagues have mentioned and I alluded to initially, I think we can do a lot better with electronic immunization records and really tracking who got the vaccine when. This remains in 2021 a major challenge in many countries in terms of really keeping track of which children got which vaccine. It's even more challenging for adults. So I'm hoping in the next 5 to 10 years, we will have a much better ways through technologies of tracking who's got the vaccine and who we need to reach.
Thanks, William. And let me come back to you. I think we'll talk a bit about the challenges of how we do that, very shortly. But let me come to Nikki first of all. Nikki, do you want to say something?
Yes. Oh, so vaccines. So we have so many technical guidance and operational tools developed within WHO, and we have been working very closely with our partners, including vaccine manufacturers and regulatory authorities and implementation partners. And more importantly, we have been actively facilitating the discussion via a COVAX facility to facilitate the vaccine allocation for low and middle income countries. Part of this activity includes our communication strategy around vaccines. So before this COVID vaccine comes to the scene, we already had a big program called vaccine hesitancy. And we have been dealing with this with our communication partners, and this really requires deep understanding of people's perception and understanding of vaccine as a whole concept of public health intervention. So this kind of emergency vaccination intervention, more so this area of vaccine hesitancy and information and communication around vaccination is so important. And especially some very strong vaccine hesitancies coming from healthcare workers, because they have more knowledge and they know more in depth about severe adverse effect and unwanted effect, and also long-term health impact of vaccination. So this, I think, is an important area of work, and I think our infodemic and infodemiology can help. So just wanted to add that part, because no matter what great vaccine we have, there will be always this kind of program And we can save, for example, for public health specialists, it's so clear that we can save millions of lives, but even one severe adverse effect case, if it was communicated wrongly, then it can destroy whole system, right? So we all know this happened in some countries in the past, and very unfortunately, we just have to start from scratch or have to start from negative position of this very strong public health measure. So I just wanted to talk about that. Thanks.
Thank you, Nikki. And for all our speakers, if you want to come in, just please, give me a wave or raise your hand, and we'll bring you in the discussion as well. But before we move on, Nikki, just maybe on that point, thinking more optimistically about sort of the impact of what's happened during COVID, we've seen a lot of the major, social media channels, Twitter, Facebook, people like that, do a lot more self-checking, fact-checking, self-regulation. We've seen, lots of great work from WHO. We've seen the EU requiring, monthly reporting from social media companies. If you're looking at the future, what optimistically can we look forward to? Do you see more regulation helping to solve this? Do you see self-regulation? Do you see the better knowledge of populations around misinformation? What do you think will make the difference going forward to help solve some of these problems around misinformation, vaccine hesitancy, some of the horrific incidents we heard about, ingestion of different cures for COVID as well?
Mm-hmm. Yeah, well, you can categorize disinformation, misinformation in many categories. You can't do very little about people who has a very bad intention to confuse the world. But otherwise, I think we as health authority, public health authority, has to recover our trust. Of course, we are based on science, but we often have huge pressure from political arena, and we try to avoid as much as possible. But we have to establish ourselves as a credible communicator for health and public health for people, and we leave no one behind. So in order to do this, I think we really have to identify communicators, really a communicator, strong communicators and trusted face, like our Director General, or Executive Director Mike Ryan, and Technical Lead Maria Van Kakov. They're always there to address questions. And then, as I said in my presentation, listening is the start of everything. So people's worry, concerns, anger, fear. So we have to address all that, but understanding people's thinking and emotions, and the background social information, I think is really important, and integrating all areas of science, not our traditional areas of science, but social science, anthropology, behavioral science, all these things are very important. So I think we were expanding our area of work by sort of absorbing non-traditional area, that a non-traditional science area of work, and which is very dynamic and interesting. But I think in order to do this, we have to deal with huge amount of information, where we see help from artificial intelligence, big data connection, and analytic capacity are so critically important.
Yeah, thank you. So let's come on to another topic, and again, I want to focus on that optimistic view. Let's look at the sort of positives that will come out of COVID. Artificial intelligence. So Amandeep, there's been AI is at a really exciting space. It's emerging technology. There's been huge inflows of capital into AI technologies. Healthcare, as always, is more difficult to disrupt, and we've seen sort of leaders in places like radiology where it's a lot easier. But where do you see AI going over the next 5 or 10 years? And where do you think are the most exciting areas for us in global health that we should be looking to and keeping an eye on?
I think AI is going to play a major role in the delivery of health services and also in research. So from drug discovery down to clinical trials, AI is going to be a game changer. Like what we saw with the vaccine development, the mRNA vaccines were developed in silico. So within a week, you had the genomic sequences being shared across the world. So this was in the form of digital data, and that led to this accelerated vaccine development. So you are going to see the next stage of that, where some of the adjustments that need to be made in line with mutations, in line with some adverse events, you would see AI playing a big role. I also see AI playing a big role in precision public health. So often the precision aspect has been seen as individualized, personalized medicine related to genomics data, deep molecular science data. But then for public health officials, managing things like vaccine rollouts or testing strategies or other kinds of health interventions, just the education aspect of the NCD's response, managing the AMR challenge, which is another pandemic that's out there. So this would require decision support systems, information management systems, where AI, like a general purpose technology, would be there. Last thing I want to mention, building on what Nikki said, the infodemic issue, yes, there needs to be this cross-domain integration. That's very crucial. But we also need to look at hierarchies of trust, because people have trusted the local GP and then, international organizations such as WHO, DG, and so on, and then national government somewhere in between here and there. So the digital transformation overall is changing the determinants of health, the social, economic, the shift to telework and so on. So these are areas where we would need more solid reflections, more nuanced reflections if we are to be future ready.
Thank you. And we'll come back to that. And thank you all for your questions. And do please keep your questions coming in the Q&A box. I want to bring in as well, we need to look at the equity of technologies as well. And we've talked a lot about high-income countries, but also the global south, and how a lot of these technologies through COVID, we need to make sure that we're not creating more inequalities as we move forward. Kelvin, let me come to you just for a second. And where I'm based in England, in the UK, we, back in December of 2019, we have 23 million monthly primary care appointments. We were only delivering 10 to 15% of those remotely by phone or online, and suddenly that was transformed to half of our appointments now delivered by video or telephone consultation, and that was just by April. And we're now got 90% capacity to be able to deal with remote consultations there as well. So a huge shift in a small amount of time. How do you feel about the future? So do you think that we will continue to adopt this technology? Is this a game changer, or do you think we'll regress? So your thoughts looking at sort of the next 5 years of telemedicine.
I think the whole story is connected. Like today, we discuss about the vaccine, whether we trust it, use it, a social response is important, and then we accumulate some data and use AI to understand. For the telemedicines, I got a strong feeling that all depends on the resources that we have. That means, for example, if our occupancy rate, hospital occupancy rate become high, we have no choice that we need to do something to triage our patients at home. If this is the case, we need more power to promote the telemedicines. But I do believe that after this, as Richard present, this is a social trust. If they through this platform, they try the telemedicines during the COVID-19, maybe later, once we have the vaccines and it is more ready, the people will use it to use the telemedicines to communicate with the doctors, all about the trust and data. because along the times we believe that we not only focusing on the COVID-19's data, but the transactions, how they use the platform, or whether they use the apps to summarize what they have a side effect, like William said, and this is very important. And all of this data will equate to a very powerful platform, maybe AI can help. In the future, it's quite important that we need to know which vaccine is the best for which types of people. Like Hong Kong, we have a 7 million populations. And when the day start with COVID-19, everyone looking for the mask. And this is, we have a huge gap to find the sufficient material to do it, but everyone made it. Now we have very, very much more than that we need. The mass production is quite fast, but the problem is we don't know next step what to do. If vaccines, one day we have a lot of vaccine, maybe we have some AI model, more personalized coaching, which type of vaccine suitable for which type of patient. Maybe this is the next trend.
Thanks, Kevin. I'll just pause in case anybody else wants to come in from our panel. So just if you do want to speak, just raise your hand. And again, for our audience watching, please do send in your questions. We're starting to kind of get those, and we'll take those very, very shortly. So I'm very optimistic. I think from our discussions and what we've talked about, I'm really optimistic that we've made sort of big pragmatic changes in technology during COVID. I think it's been a terrible period as far as healthcare, but I'm hoping that we can emerge with some of those, optimistic visions for the future, both in vaccine development and AI, and more efficient, effective telemedicine care, and in misinformation as well. But any reflections on particularly that? And William, love to hear from you.
Yeah, so I just wanted to add a different angle to what we've learned, if you will, during the pandemic, and that's on the regulatory side. I know that that's not strictly a technology, but obviously particularly biomedical technologies, need to go through an approval and regulatory process. And I think we've learned that in the midst of a terrible pandemic, we can evaluate vaccines very quickly through the clinical trial process, and we can have a regulatory process that approves vaccines very quickly. And again, normally this is a very prolonged process. And I want to emphasize too to the audience that no corners were cut, no cuts taken. This was done in a very rigorous scientific way. But I think we have learned that we can move novel vaccine platforms and new vaccines through the regulatory process very quickly. And I'm sure for other technologies, there are approval and regulatory processes as well, certainly for diagnostics. And so that may be another lesson, Ashley, that kind of comes out of the pandemic that we can carry forward.
And let me come to Nikki next.
Yeah, well, William, thank you for that point. And then I also wanted to ask Kelvin, because you said that even in Hong Kong, it's still challenging to share the database, and this is really problematic. We have to solve this problem with introducing interface, and I understand the flip side of it is a protection of privacy and stuff. But and this is really critical, and then I think it's an obstacle and the bottleneck right now, because if one patient is being diagnosed as COVID-19, the national authority should receive automatically if this electronic patient record are connected at the central level. And then, the same for vaccination record. And if the person's been tested for antibody, then antibody should be the information should be there. And all these information, I think, is really critical to help the public health decisions, because now we are facing this variance problem. And then there are emerging questions. whether those variants, I mean, the vaccines that, let's call it the first generation vaccine. So this vaccine was based on the original viruses before all these mutation happens. And then the question is, so for the timing, we have good news that there are some cross protection and neutralization wise, there's no problem. But you know, as the people's natural and a passive immunity develops, then you know, naturally the virus starts mutating, right? And then so yeah, ongoing monitoring whether a vaccine failure is happening or not. Of course, we can design a prospective observational study, but if all these information are entered in electronic patient record, then we can easily follow up these information. So that I see is a huge gap now. You know, all the individuals using this telemedicine and electronic patient record. Why can't we use them for monitoring the situation in terms of people's immunity and vaccination status, and then all other factors like, you know, age and underlying conditions? Everything can be integrated, and we can answer difficult public questions like that if they're all connected. Over to you, Kelvin. And
I think this is also the challenge before the COVID-19. Everyone keeps some kind of health data, including Fitbit, exercise, and the health organization keep the traditional medical records. How we communicate, difficult. But now COVID-19, that's why I bring up the concept of blockchain. Because in the past, someone talked to me, blockchain, how to apply the medical data is challenging because medical data is well trusted. When you have a medical treatment, your record is true, put it in the health system. But now COVID-19 is a very complex story. So sometimes we need to share the data between the people, the organizations, or everyone want to carry their data. So that's why I bring the idea from fintech, the blockchain. This is a chance to protect our privacy data and make sharing. But the next step, how we go it, and I think it will be coming up very soon because a lot of companies think in this direction. Yeah.
Mandeep, do you want to come in maybe on, again, sort of the regulation side? Because I think we've had a question, and we've talked about regulation of things like particularly AI, and whether that's you know, a positive, whether that's a negative for regulation, and how do we regulate quite a complex, you know, specialist field as well?
Yes, so we would need to shift to more smart regulation, more proactive regulation, where you normally regulators wait for the product to come out and then they do it at arm's length from the developers. So you need to change that and bring in the companies, the techies into the conversation earlier. So more agile, more forward-looking regulation. But you would also need to focus on a distributed approach to governance. AI is a technology that cannot be regulated exclusively at the international level, in some ways, you know, at the industry level. So you can't let the industry do it all by itself, or you can't have a treaty, international treaty. So there has to be a sophisticated play between the international level, where, for example, WHO, OECD play a role with guiding principles and other forms of norms. And then the national governments come in with privacy protection, interoperability type of issues, trusted fiduciary type of initiatives. And then the industry follows up with standards, with ways to bring ethics into the entire development cycle and use cycle, from design to post-use assessments. So different approach to regulation, and we need to separate the data side from the AI side. I mean, we've seen with the problems with the vaccine rollout at Stanford University, or the algorithm for examinations in the UK. So the problem is not the algorithm alone or the data alone, or the designer. So it has to be done, the regulation has to be done in a very nuanced way. Who's responsible? Whose liability is it for the decisions taken on the basis of the combined data plus AI plus the human decision-making side?
Yeah, I want to give a feedback to the Ahmed. This is very important. I think AI is all about the technology, how we apply. But once we have insufficient data or the data is not correct, how we can do. I think we have to keep both thinking. I really enjoy your sharing that we need to have a dashboard. Dashboard is the first step, how we understand our data and then put it on an AI model. In fact, a lot of AI model may not be better than the traditional, maybe regression, all about the data availability. If we have more data, I'm sure that AI will help the world. So the timing, how we include more data, how we collaboration with the team, how we keep the language speech between the from vaccine data, platform, AI is very, very important.
Yes, and the equity aspect, someone has mentioned the chat. How do you make sure that poorer resource settings can use this? I think lowering the entry barriers, low-cost devices, no-code, low-code approaches to design, and then these public goods where you create these platforms, whether based on digital identity or interoperability standards that allow everyone, regardless of a smartphone or a feature phone or broadband access or simple 2G, 3G access to benefit from these technologies.
Thank you. And we've had a couple of questions, Amandeep, and I want to go into some of the questions now, just in the interest of time. We've had a couple of questions really about the equity across all the things we've talked about. So the equity of access to lots of these technologies. And maybe William, you might want to reflect as well, is that we're going into a period now of lots of challenges. We've got really innovative new vaccines, mRNA vaccines. We've got very expensive vaccines. We've got many different types and vectors of vaccines available. What's your thoughts around how do we make sure that we just don't have rich countries having access to these vaccines? Thinking about the technology and how we move forward with that.
Yes. So this is a critically important question, Ashley, and obviously there's been a lot of thinking about how to achieve equity, but we've already seen inequities with a small number of wealthy countries purchasing large volumes of vaccines. We also have the issue that many people are aware of, with the messenger RNA vaccines, and particularly the Pfizer messenger RNA vaccine requiring ultra cold storage, which is a resource that's not available in many countries. But I think, here's where, coming back to, Nikki had mentioned, I think, COVAX earlier on, the COVAX effort led by Gavi and the World Health Organization and CEPI, that's really, a remarkable achievement, I'll say, and really our best shot at achieving global equity with vaccines. So I think we, and maybe that's one of the, big lessons learned from this pandemic. But we do need to ensure that there's equity, but it's an aspirational goal right now, I'll say, right outside of COVAX. And, a lot of the rich countries have invested heavily in the research and development for vaccines and have made, bilateral arrangements with the vaccine manufacturers, and so have early access to the vaccines. Well, the short answer is, Ashley, I think the mechanism of COVAX is our best shot right now to achieving global vaccine equity.
Thank you, William. Nikki, anything you want to add to that?
Yes, I just wanted to remind everyone about our pandemic influenza preparedness framework that agreed by all the member states of WHO. And this heavily involved manufacturers. And we asked manufacturers either to contribute financially or in-kind donation. So every vaccine they produce, using GISRIS, the WHO's influenza network system that defines the strain of vaccine selection for the influenza virus. As a return, we receive like 10% of the all production of that manufacturer. That way, systematically, we can get vaccine, physical vaccine, no matter how many bilateral, arrangement takes place, but we get 10% from the beginning of all the production of the manufacturer. So that was a fantastic system. And then other benefit we get from this pandemic system was that we can also get some funds, fixed funds from manufacturers, so that we can use them for strengthening surveillance and diagnostics and supply of antivirals and stuff like that. So we should really, now COVAX is really moving towards that direction, because we spend so much time and energy and people's brain on to establish this pandemic influenza preparedness plan, because vaccine was really core intervention for pandemic influenza. And we now see the virus is moving and mutating much faster. So we should envisage the time that COVID becomes like influenza and we have to revise the vaccine every year. So that's one of the possible scenario. And if it goes that direction, that we have to make sure that we get some portion of all the production for the low and middle income countries and fragile population like refugees. Over.
Thank you. So I want to move on and take another question that's come up actually a couple of times, which is a challenge we always face in technologies, which is sort of the education and learning. And I think, whenever COVID hit, we all made a huge jump. We had to get used to kind of doing these Zoom calls and realizing when to mute and unmute. It was a challenge for all of us to be able to do that. A lot of our health systems adopted really quickly, out of need of the fact that they, had to change how they operated, adapt existing systems to deliver telemedicine remotely. But from your perspective, what do we need to do to make sure that people are, particularly in healthcare, trained and educated to make the best use of these new technologies? Because I think the realization in the past is that we haven't properly made use of things like telemedicine, AI, because a lot of us didn't understand it. We weren't used to it. We've been forced into that situation. But what do we need to do going forward to make sure that as a global healthcare community, we can make best use of these technologies?
Let me try.
Kelvin.
Yeah, this is very challenging questions, because in Hong Kong, we also have this mindset, because medical students, they maybe more enjoy biology. If we ask them to do more AI or machine learning, maybe very challenging. But at least we add some lectures to let them communicate, listen some about the machine learning, supervised or unsupervised. At least they have a common sense, or not common sense, common language to communicate with the engineer. I think this is a very important step. And at the same time, sharing information that let the community trust what is happening is also very important.
Amandeep.
I just want to build on what Kelvin said. I think at the undergraduate level, we need to introduce some cross-domain work for engineers and for doctors. So if engineers can start to work with medical images during undergraduate studies and work on some of these public health challenges, and COVID-19 has been a stimulus for that, that improves that cross-domain capacity on the computer science, digital technologies side. Likewise, on the medical side, there's been a renewed interest in data, in biostatistics. So if you can introduce more of those courses at the undergrad level, and then something that I've seen at the government level succeed very well in countries such as UAE, Singapore, and Israel, is to take mid to senior level policy people from different ministries through combined courses on the digital transformation, and then have them work on interdisciplinary projects after they finish their training when they get back, let's say. on agriculture, having someone from not just from the Ministry of Agriculture, but other ministries to come together and work with the private sector in the field. So that kind of cross-domain experience is precisely what we need to challenge, to tackle these complex challenges. And let's not forget that we have this 18 million shortage looming of health workers, and you need to train them and train them well, and we won't be able to reach those targets without digital technologies.
Yeah. One more point to supplement Amanda. Dashboard data visualization is also very important to understand the story faster than or they feel easier to adopt what is engineering, what is data science, and next step they may feel enjoy to do the AI.
Thanks, Kelvin. So we're going to take one final question, and then we're going to slowly wrap things up. Just we've posted a link to our closing poll, which is really asking about your optimism after today of whether you think technology will make a big impact in the future. So you can see the Slido code in the chat box. I want to just close with a final question from our audience, which is, William, you talked a lot about vaccines as solutions for managing COVID and future diseases as well. But we've heard, how technology, how AI actually was able to give us advance notice before our traditional epidemiology tracked down COVID within Wuhan. And the question is about whether technology can help us to monitor global health to avoid a future pandemic in future, and whether some of the technologies that we have can help us, avoid what's happened with COVID becoming a sort of global pandemic. But any quick reflections from anybody on that? William.
Yes, I'll start. I mean, that all starts with kind of basic public health surveillance, but I have no doubt, and my colleagues on the panel can probably better address this, but that, digital technologies and AI can play a crucial role going forward in helping us advance our surveillance techniques and our ability to detect crossover or spillover events or new pathogens very early on. Obviously, it's still dependent on humans, but I think I think digital technologies can play a critical role in enhancing disease surveillance.
Yeah, just to quickly add there, Ashley, to what William said, I completely agree. I'm very optimistic about this. This One Health approach, where we look at environmental degradation, climate change related shifts, human-animal disease through these complex digital models and through multiple data streams. This is a global challenge which requires a new CERN-like approach, but this is going to be hugely helpful, and we would avoid trillions of dollars in future damage if we can start building it together now.
And maybe just in the last couple of minutes, if I could just say each of you in turn to maybe just kind of give your key takeaway points for our audience watching today. So maybe let's start with you, William.
Yes, I mean, listening to the panel discussion, I think, Ashley, I'm even more optimistic than I was at the beginning of this discussion. I think we've learned a lot through this pandemic, and I think this will if we learn these lessons and apply them, we will be in a better place in the coming years. Maybe I'll just say, actually, just one thing that was occurring to me, as we were discussing, that obviously there's a lot of concern about the variants, the vaccine variants. And I just wanted to highlight that one of the real advantages of these genetic vaccine technologies, the adenovirus vector and the mRNA, is their ability to really be readily, quickly adapted to new viral variants. But it is the regulatory side that potentially could slow things down. And I just want to come back to this interface between technologies and regulatory processes. If new vaccines are, if a new variant gene is put into an mRNA vaccine, is that viewed and regulated as a completely new vaccine, or does that get kind of expedited through the process? So there is this, there is this really important interface between new technologies and the regulatory processes that we need to keep in mind if we're going to really leverage these new technologies. Thank you.
Thanks, William. I think it's going to be really exciting to see where these technologies go in future as well. Kelvin, your final reflections.
Yeah, just a recommendation, not just focusing on one thing. When we don't have vaccine, we focus on how to use the mask, social distancing. But in fact, all are important. using masks, social distancing, vaccine, and use the data, understand ourselves using AI model to how to make a better predictions, how to use or handle the situations. Data will gain more trust from the audience and also from the society. And open your mind to try health and lifestyle technology. It is very important for your future, not just for COVID-19, and also maybe a comprehensive approach for our future health management. Thank you.
Thank you. Nikki, your final thoughts.
Well, I have to say that infodemic is really important, and misinformation management communication is really important as vaccines and treatment and surveillance and all that. So information management is important, but that's my area of work that just re-emphasizing. But thanks, William. I think your term interface is really a key. And if we can just turn this key to open the door, we will be in a different dimension, because we still see a disconnection of patient data, research data, and surveillance data, lab data. They're not connected well enough. So we need interface to connect all these data. Then we will see a different horizon, that is for sure. So I think that's the way forward for the next 5 to 10 years. Thank you.
Thank you, Nikki. And Amandeep, your final reflections.
I think we've seen already a lot of solutions. We now need to move from solutions enabled by technology to enablers of those solutions, such as the interface issue that Nikki mentioned, the interoperability issue, as I could put it, some of the governance enablers, some of the data protection enablers, breaking of silos across domains. And then from the enablers, we need to start thinking about new ways of collaborating. So new kinds of, like COVAX was mentioned, so we need new reinvention of multilateralism in the digital age. So we have to kind of have this shift from solutions to enablers to new normative and collaboration frameworks. But I'm very, very optimistic, also listening to all the panelists today, that we are on the right path.
Thank you, everybody. And it's, we try to cover an awful lot in this session, and I'm sure we could talk for many, many more hours about these technologies, but we're coming to the end of our time. I want to wrap things up by, again, thanking our expert speakers. Really appreciate the discussion we've had today. I've learned a lot, and I've been hugely inspired about what we can achieve in healthcare over the next decade. So thank you again. And thank you to all our audience who have joined us today for all your questions, your input, and your polls as well. So I think, unfortunately, we've come to the end of today. I want to thank you again, and I'm looking forward, hopefully in a couple of years' time, we come back and we reflect on what we've learned from COVID. So thanks again, and we'll see you all soon.